Hello, my name is Dr. Nitiraj Oberoi. I am the Orthopaedic Director at the CK Birla Hospital at West Punjabi Bagh. We shall discuss hamstring injuries today. Hamstring injuries are common injuries. They are seen in all age groups and all levels of sports people. In the younger people, hamstring injuries happen because hamstrings of the youth, sometimes by birth, are much tighter, resulting in less resilience to stretch. So those people who are less than the age of 20 and start exercising a little more aggressively are more prone to developing pains which start announcing themselves by thigh soreness after a workout or after playing a sport, which lasts longer than the usual 2 or 3 days. If the same injury lasts longer or becomes acutely painful, and especially so trying to walk or bring a foot forward, it needs attention from a doctor. Another thing which hamstrings tend to do in the young people is they tend to pull your pelvis backwards, and that leads to backache. So you may have low-grade backache for a long time and suddenly develop a hamstring tear. So young people with backaches which do not seem to have any other reason should always be investigated for tight hamstrings. One leads to the other and vice versa. In the more middle-aged people, hamstring injuries are violence-based. So you suddenly started exploding on, say, a tennis court or a squash court, or a vengeance on doing long-distance running or doing hurdle training, then hamstring injuries happen. In the gym, hamstring injuries take place, especially when we are trying to lift weights from in front. This happens especially so when we are doing deadlifts. So deadlifts have a very high preponderance to hamstring injuries. In the elderly, hamstring injuries again happen because the pelvis becomes stiff and the hamstring too becomes stiff with age. And in those cases, hamstrings happen as a result of softer sports. So a game of golf could lead to a hamstring injury. So how do these things present? They present by pain. The pain can be either in the buttock, in the upper part of the back of the thigh, and occasionally in the lower third. In the younger population, the pain happens in the lower third of the thigh on the back of the thigh. This is the junction of the tendon with the muscle. In violent injuries, if there has been a violence to it, it usually injures the origin of the hamstring, which is at the buttock, the bone on which we sit. And in the more commoner injury pattern, it is a partial rupture of the muscle which happens at the junction of the mid and the upper 1/3 of the tendon, which means a couple of finger breadths below the fold of the buttock. Pain, restriction, and difficulty in walking, which lasts a few weeks, is a hallmark of a subacute to a chronic hamstring injury. Treatment, investigation wise, this is more or less a clinical diagnosis, but it can be augmented with musculoskeletal ultrasound, and in certain cases MRI, especially for those which are getting avulsed or ruptured from their origin at the buttock. Treatment largely is symptomatic, avoidance of sports, pain management with ice packs, medication, rest, and physiotherapy. Interestingly, physiotherapy involves modalities, which means certain kinds of machines, and stretches. So the very injury which causes a hamstring injury, which is a stretch, is also used to treat it, but under supervision. Very rarely a hamstring injury may need a surgical intervention, and this usually happens when the avulsion happens or the rupture happens at the buttock. So you can reattach back a hamstring injury in where the muscle has undergone a complete rupture from its root. Long-term prognosis of these injuries is good if they have been treated well, and if the rehab process and return to activity is slow and under the supervision of the surgeon. Thank you.